give us your name and address for the record, please.
Marissa Bonds, 420, Health Director for the City of New Haven, 424 Chapel Street. Good evening. Today I'm going to be talking a little bit about the grant overview, and so I'm going to just talk a high level of the executive summary, and then I'll open it up for any questions that you may have. The New Haven Health Department proposes to implement better resources in education to address tobacco grants, tobacco harm and exposure, also known as BREATHE, to lower tobacco use rates among all New Haven residents and help them lead a healthier tobacco-free life. BREATHE aims to build on and expand the ongoing tobacco-free New Haven project led by Mayor Hart and other and New Haven's newly passed smoke shop ordinance. BREATHE seeks to, 1, assess rates of tobacco use and risk related to secondhand smoke for teens and young adults and to identify effective outreach strategies. 2, prevent the initiation of tobacco use. 3, eliminate exposure to secondhand smoke and aerosols. And 4, evaluate the effectiveness of implemented strategies by measuring changes in smoking rates among youth, community engagement levels, and policy adoption metrics. BREATHE will serve the City of New Haven and South Central Connecticut Planning Region, focusing on instrumental project resources on their adjacent towns of Hampden, West Haven, and East Haven, respectively. Nearly 5,000 adult smokers in Connecticut die each year from health problems related to smoking, and hundreds of non-smokers die due to exposure to secondhand smoke. Tobacco use costs Connecticut about an estimated $2 million per year. About 12% of Connecticut high school youth reported recent use of some form of tobacco, and 35% reported recent exposure to secondhand smoke or aerosols. The prevalence of tobacco use was notably higher among females, and rates were markedly elevated among LGBTQ plus students and students with mental health concerns. Tobacco marketing exposure has been causally linked to tobacco use initiation, use frequency, and relapse. Over the last 10 years, the e-cigarette industry has pursued a concerted social media marketing campaign targeted at teens and young adults, resulting in rapid increase in e-cigarette use. To effectively target our planned interventions, New Haven Health Department will first conduct a comprehensive assessment of youth, young adults amongst the age of 12 to 24 in collaboration with the New Haven Public Schools, Regional Health Department, and districts and relevant organizations across the region. Armed with this data, we will launch 2 sets of intervention. The BREATHE Smoking Prevention Media Campaign will include strategies effective at reaching youth and young adults. The Health Department will implement a comprehensive evidence-based social media campaign aimed at preventing teens and youth between the ages of 12 to 24 from initiating tobacco use. This campaign will also build awareness around the risk and discourage initiation of vaping and smoking cigarettes around and social responsibility and acceptability of tobacco use, and encourage behavior among young discourage young behavior. Excuse me, sorry, my reading, I was like switching a page. Discouraging smoking. In addition to the paid media, the campaign will focus on grassroots outreach. New Haven Health Department will develop a peer-driven campaign component where youth will be able to co-create campaign materials. So this is in essence going to be a peer-to-peer driven campaign initiative as well. We will also implement a comprehensive place-based strategies for schools and community spaces, focus on raising awareness among the dangers of tobacco use and vaping. Work involved will empower youth with the knowledge and resources to make healthier decisions while fostering a supportive environment that actively encourages tobacco prevention and cessation. We will partner with the New Haven Public Schools and the Physical Education Department to ensure that the tobacco-related curriculum are based on current best practices in health education and that students receive accurate, up-to-date information on the risk of tobacco use. We will also develop and deliver extracurricular prevention activities to be delivered throughout the community, utilizing community health workers and partnering with community-based organizations and community leaders. The retail environment is a major avenue for tobacco product marketing and promotion, and point-of-sale interventions will build in the city's 2025 smoke shop ordinance and includes a test purchasing strategy. So as you recall, when we were passing smoke shop ordinance, we implemented an ordinance to go into effect in October that we will have point of sale intervention. So if funded, this grant will provide the stipends for those 18 to 20-year-olds to be able to be the shoppers for us and to be able to see if any of these smoke shops will sell to underage. Likewise, the brief's secondhand smoke strategy will include performing a detailed review of the status of smoke-free ordinances that have been proposed or enacted across the region, working with national experts to explore additional possible legislative restrictions related to private rental housing and non-city owned outdoor spaces, working with city leaders like yourself to strengthen enforcement of smoking prohibitions through widespread education efforts, pervasive signage in public places, and periodic enforcement actions, and providing technical assistance to area health departments and municipalities to support their efforts and to institute more complete smoking bans. The New Haven Health Department will work to expand and reach enforcement of smoke-free housing and workplace policies, and we will produce materials and perform outreach to alert residents to the dangers of secondhand smoke and inform tenants and workers of their rights and options to protect themselves. The proposal is approximately $540,000 per year over the grant period, with a total of $1.62 million. About $926 is allocated for salary and fringe. $592,000 will be for marketing, contractor to develop and implement marketing campaigns, and about $75 for marketing giveaways. The health department will sustain the project after the grant funds expires through its multifaceted sustainability plan based on addressing core agency capacities. The New England Health Department is in good standing with the funder, which is the Department of Public Health, and we are hoping to hear soon. If funded, this will go into effect starting December of 2025. And that concludes my executive summary.
Thank you very much, Director Bond. And I'd like to see if my colleague wants to introduce herself.
Sarah Miller, Ward 14.
Thank you for joining us.
My apologies for being late.
No problem. Do we have any questions from members of the committee? Alderman.
Thanks, Mr. Chair. Thank you, Director Bond, for your presentation. Just one quick question. I remember I grew up in Kentucky and I did DARE in 5th grade, and we had an essay contest and I think had weekly sessions. How has messaging or best practices sort of evolved since then? I think that was maybe 10, 15 years ago.
Yeah, there's different models for sure, and that's one of the things that we will do an assessment of to see which best model will be able to work for our kids. Because our kids also are inter-district, we're going to be working with partnering with the Board of Education to also ensure that our messaging is going to be able to target the different types of student population that we have.
Thank you, Director Bond. Thank you, Mr. Chair.
Thank you, Alderman Smith. Any other questions from the committee? I have one question, which is, I was wondering if the health department has either had this grant specifically or similar grants in the past from the Department of Public Health or from similar.
So this similar grant was funded before my time, and this particular administration, it was during the Tony Harper administration, the Community Services Department. So we did have a similar grant in the past.
Okay, and do you know what kind of results or is there analysis that the city has about how that went when we had this similar grant?
We did review that material and incorporated that into this grant so that we can be able to strengthen our application. And so it was successful for sure. And there were some things that we reviewed that were incorporated into this proposal.
Understood. Thank you. Alderman Rodriguez.
Thank you. You, my colleague mentioned DARE. What is your plan to do outreach to the youth?
So we have a whole extensive work plan that we developed that's going to be strategized around the entire district. So we're going to be also partnering with libraries and different community-based initiatives because we want to make sure that we're not just doing it in school, we're engaging in schools, but outside of school. We're also in the work plan input. There's specific places that children like to frequent. So we thought about different locations like coffee shops and things of that nature. Like right now, we know that the kids love to drink bubble tea. Is it bubble tea? Yeah, something like that. So I know I'm always drinking it, the taro one. But anyway, so we were thinking, we have in our work plan definitely creative ways to engage the youth beyond just the school, and also through the social media as another avenue.
Perhaps through you, Mr. Chair, I think that if Director Bond gets more information so that there are 30 Alders in this city, in assisting in the messaging or lining up with our health director, the more advertisement out there for our communities, that would be important. So through you, if you get any information or if you have a conversation with the director. Thank you.
We can certainly share that. Thank you, Alderman.
Thank you, Mr. Chair. Thank you for the presentation and thank you for this project. We desperately need this. Thank you for your advocacy on other related state and local efforts. You know, we've been very concerned about bad actors, so the sweatshops, and even on the street, selling tobacco products and cannabis. And you mentioned something about people going in to try to participate in forceful 18 to 21-year-olds. And I'm sorry that I was late in this full presentation. So what exactly, is that part of this grant or is that something?
It's a combination. So it's already in the ordinance that was passed. And the way that we're building in the capacity is that this particular grant will be allow us to pay them stipends. Because in the ordinance, it says that we may be able to do so, and then this will allow us to like secure funding to be able to pay the 18 to 20-year-olds to go in as mystery shoppers.
Okay, that's great. I think that could have a really big impact. I mean, we just see huge numbers of 10, 12, 11-year-olds with vapes at school. And so, great.
Well, thank you. And I just want to add that this is already being done at the state level. So the state is already hiring mystery shoppers. Is not a new concept. I'm just like doing an extension of what the state does, so that we can have local capacity.
Thank you, Mr. Chair.
Thank you, Alderman Miller. Any other questions from members of the committee? Because I would ask one additional question. You talked a little bit about the staffing that will be personnel that will be paid using these funds. Are those going to be new folks on the team, or some salaries in the health department currently will be paid with these funds?
It's gonna depend on the dynamics that we're dealing with the state. We have existing community health workers right now that grants are going to be ending, and so I typically they're public health professionals, and so I try to move them to another grant to avoid any layoffs. And so oftentimes I'm looking not repurpose, but like just redirect staff to be able to stay because they have already an extensive history with the department. But there is also going to be new staff hired.
That's helpful to understand. Thank you. Any more questions? Seeing none. Thank you, Director.
Have a great evening.
Thank you.
Appreciate your presentation. All right, we will now ask for any public testimony on this item. Is there anyone from the public wishing to testify on this item? And the second time, is there anybody wishing to testify on this item? And a third and final time, is there anyone wishing to testify on this item? Seeing none, do I hear a motion to close the public portion?
So moved, Mr. Chair.
Second.
Hearing moved and second. All in favor of closing the public portion of the hearing, please say aye.
Aye.
Any opposed? Any abstentions? The public portion of the meeting is closed. Do I hear a motion to move the item?
So moved, Mr. Chair.
Second.
Hearing moved and second. Any discussion?
Mr. Chair.
Okay. Please.
If this grant been awarded, I think this is a great direction towards tobacco control for youth, so I'm in favor of this. Thank you.
I'll just echo my colleague, as I said to Director Bond, I think this is like a really severe challenge that we're facing, and it's great to see resources potentially coming to the city to help us.
Thank you.
I echo the sentiments of my colleagues, both Alder Singh and Alder Miller. This is an important time in New Haven that our youth see movement and move towards healthy living. I think that what Director Bond presented today, and if we, again, all work together and move this throughout the whole city, we can absolutely re-engage youth and explain to them what longevity means when we are not using tobacco products. So I think this is a great opportunity for us. Thank you, Mr. Chair.
Thank you, Alder Rodriguez. I agree with my colleagues in support of the item. I think that it's exciting to see the city pursuing this education initiative. We were glad to have passed the smoke shop regulations earlier this spring, which bring in some regulatory efforts to cut down on access to smoking products, especially for young people. And it's good to see education efforts as well to make sure our young people and people throughout the city know about the harms of smoking tobacco products. Seeing no more discussion, all in favor of moving the item?
Aye.
Any opposed? Any abstentions? The item passes. Do I hear a motion to adjourn?
So, second?
Make a motion, we adjourn.
Do I hear a second?
Second.
Hearing moved and second. All in favor of adjourning, please say aye.
Aye.
Any opposed? We are adjourned. And just so folks in the audience know who have just